The 2008 recession caused the highest unemployment rate in the United States since 1982 and also increased household debt dramatically. As a partial response to the 2008 recession, employers shifted healthcare costs to employees in an attempt to reduce company overhead. In the past 6 years, though, unemployment has recovered and much of the household debt has been paid down. The result has been an increase in the use of elective healthcare procedures due to greater discretionary income per household, even with the additional cost burdened by employees. As the demand for healthcare services increases due to reductions in unemployment and household debt, the Bureau of Labor Statistics is projecting significant increases in the demand for medical record and information management staff by 2020. These positions are critical for accurately maintaining patient data and providing access to that data for patients, physicians, and insurers.
Healthcare retrieves many different demographics, including age, race, and gender, to define populations and health concerns of that population. There are a few different demographics that will drastically change between now and 10 years from now. The baby boomer generation is approaching the age of 65, and within 10 years will be Medicare eligible. As the majority of people will now be over 65, the healthcare concerns of the community will change to be on those conditions more prominent later in life, including cancer, diabetes, and heart disease. Another demographic that is constantly changing is the population trend relating to race and ethnicity. Between now and 10 years from now, there will be more Hispanics, Asians, and other races within the United States. As this demographic changes, the community health concerns will change and focus on those diseases that affect each specific race. With all the demographical changes, especially in age and race, one of the jobs predicted to grow in healthcare is health educators and community health workers. The projected growth rate is 21% between now and the year 2020 for this specific job. The duties of this job include developing, promoting, and implementing strategies to improve the health of the community. Health educators and community health workers also collect data using demographical questions to discover the community's main health concerns, which helps them identify which programs are most needed in the community.
Personal lifestyle and behavior choices are increasing the prevalence of chronic disease. People living with chronic conditions such as heart disease, cancer, diabetes, stroke, and chronic lung disease account for 75% of healthcare expenditures in the United States. Between the years 2000 to 2030, these conditions are projected to increase by 37%. The National Prevention Strategy really needs people to develop the knowledge, skills, and motivation to make healthier choices for better self-management. This will lead to a reduction in the amount of costly, preventable diseases affecting the nation. A lifestyle health coach is a trending career for the future as it is a cost-effective way to support patients in the healthcare setting. A lifestyle coach is there to educate the patient on how to better manage their condition and evaluate when barriers to behavior reform are encountered. There are a variety of factors a lifestyle health coach manages: nutrition, physical activity, weight management, stress management, tobacco cessation, and sleep management, which could all contribute to a patient's chronic condition. Providing patients with support that encourages behavior change towards a healthier lifestyle will be utilized as a way to control healthcare costs from rising uncontrollably.
In general, technology is one of the most common trends, especially in the healthcare field, and is continuously growing. Hospitals, private offices, and other healthcare-related offices and companies are using technology to cut costs and increase productivity. Healthcare is doing all this not only through the use of the electronic health record and the electronic medical records, but also through the use of smartphones and apps. Patients, physicians, and healthcare managers are mobile in their everyday lives, and now technology is allowing for patients to stay more connected and have easier access to their medical records, as well as other resources they need to get the best medical care possible. Parallel to the use of electronic healthcare records and electronic medical records, the use of cell phone applications is increasing in technology. Not only will physicians be able to use smartphone technology, but it will open up job opportunities for healthcare managers. These jobs will include IT developers to design and run the applications that will allow physicians and patients to better access their healthcare, but also managers will have opportunities to work as application managers to monitor patient accounts and maintain the appropriate connections between the physician and patient.
With the implementation of the Affordable Care Act, also referenced as ACA, federal and state insurances had to undergo a major overhaul. Many rules and regulations were amended in order to meet the needs of consumers. Medicare is controlled by the federal government. Under ACA, the FDA has allowed approval of generic drugs, which has significantly reduced prescription drug prices. FDA has also mandated that insurance companies were not allowed to deny insurances to individuals due to pre-existing conditions. CHIP is known as the Children's Health Insurance Program, which is controlled by states. Under ACA, there has been a significant increase in enrollment. This is largely due to amendments to income guidelines. With the continued changes in affordable health care, there will be an increased need for transparency in terms of patient records. For healthcare managers, projected job growth in 2020 is expected in health informatics. What does this mean for healthcare facilities and hospitals that are receiving Medicaid and Medicare funds from the federal government? They are now mandated to utilize EHR, which is known as electronic health records. The federal government is requiring transparency in how patient records and data are being handled by these facilities. What does this mean for health informatics professionals? Longevity in career. It increases their chances of permanent career in health informatics. There are various subdivisions of health informatics, which includes medical informatics, clinical informatics, nursing informatics, bioinformatics, dental informatics, public health informatics, and veterinary informatics.